Hi there, welcome to Bloom again. Today we're going to start talking about the aspects of medical surgical. What's medical surgical? It's a specialty that employs an array of knowledge and skill to provide care to adult patients requiring medical or surgical management. There are some professional organizations like the Nursing Gerontological Nursing Association and the Academy of Medical Surgical Nurses. Both of them have different purposes. The first one is for nurses practicing in medical surgical settings, and the second ones are focusing on the clinical care of older adults. NAPTIS standards, National Association for Practical Nurse Education. Which are the standards for this association? Well, the first one is to comply with the ethical, legal, and regulatory frameworks for nursing. Utilize educational opportunities for lifelong learning. Identify personal capabilities. Identify strengths and limitations. Demonstrate accountability and advocacy. Be a positive role model and be conscious of the impact of being an LPN. Communication is very important for a nurse. Well, everywhere. But for a nurse, I think it's crucial. We need to learn how to give relevant, accurate, and complete information, appropriate report to the appropriate person in the appropriate time. We need to learn confidentiality, how to utilize information technology, and how to use appropriate channels of communication. Let's go to the assessment. It's a collection and processing of relevant data with the purpose of appraising the client's health status. It not only includes the physical assessment, but it's a holistic one. It includes emotional, mentally, and more. Planning what to do, evaluate problems, and think about interventions that can help solving it. For example, my client is malnourished. What can I do for helping him? My client is high risk of falling. What can I do for making my patient not fall? Probably using not skid socks or making sure that he has a call light near him. Caring interventions. Behaviors and actions that can assist clients to meet their needs to achieve the desired outcomes. Managing. The effective use of human, physical, financial, and technological resources to achieve the desired outcomes. Now we go with ethical considerations. The resolution of an ethical dilemma. Which is the first step? Well, the first step is this an ethical dilemma? 2. We need to gather information. We need to gather as much as information as we can. 3. Clarify values. 4. Verbalize the problem. 5. Identify possible causes of action. 6. Negotiate a plan. And 7. Evaluate the plan over time. Let's go with legal considerations. This is pretty important. Please remember, nurses are responsible to know their legal obligations and limitations to protect themselves and their patients, of course. But remember, to protect themselves. Nurses need to know 2 words. Third, which is a civil wrong against a person or property, and professional negligence, which is malpractice. Example of negligence, well, failure to monitor a patient, to document findings, to notify other staff of changes in patient status, to maintain or correctly use equipment, to respond or to correctly carry out orders, to follow the 6 rights of medication administration, to convey discharge instructions appropriately, to ensure patient safety, especially those who are at risk of injury. failure to follow policies and procedures, failure to properly delegate and supervise, and there are many, many of them in the list. I will continue talking about this topic in my next video, so give a like and see you then. Bye bye.